Hi everyone, I'm Dr. Rita Roy with the National Spine Health Foundation, and I'm here at Nemours Children's Hospital in Wilmington, Delaware with Dr. Suken Shah. It's Scoliosis Mentoring Day here at Nemours, and we are delighted to be here to support the patients and patient community with Dr. Shah. Dr. Shah, tell me about your vision for this day and what's going on here.
Well, this is about a decade in the making. We wanted to celebrate and increase awareness for Scoliosis Awareness Month. And several of our nurse practitioners recognize the need to educate families and make people feel more comfortable about the journey of their scoliosis treatment. So we have a great session that's engaging for both patients and families. We start together in a room, and then we have breakouts for both the patients and the parents. And the education is really directed around peer-to-peer mentorship, empowerment, and sharing information that's evidence-based.
And Dr. Shah, remind us of what your role here at Nemours Children's is.
Well, currently I'm the chair of orthopedic surgery. I was appointed to that position just about 9 months ago. And for at least the last 15 years, I've been leading our scoliosis division. And I'm a pediatric orthopedic surgeon by training, but my practice is now specialized to pediatric spine surgery for the last 18 to 20 years.
That's amazing and impressive, and congratulations, Dr. Shah. We're so delighted that he's taking some time during this busy day to be with us and talk about the importance of peer-to-peer support and mentoring. One of the privileges I have is to get to work with Dr. Shah as a member of the Medical and Scientific Board of the National Spine Health Foundation, and also in his dual role as the president of the Setting Scoliosis Straight Foundation. Setting Scoliosis Straight Foundation is an awesome partner of the National Spine Health Foundation, and we work together to try to build awareness for patients and their families. And one of the things that people tell us is that you feel so alone when you get a diagnosis of a spine condition, and particularly for young adults and adolescents and children, feeling alone and isolated is probably one of the scariest things, not just for the kids, but also for their families.
Yeah, absolutely.
And Dr. Shah, what are some of the challenges that you face when patients come to you and they are first given a diagnosis of scoliosis? What are some of the challenges that you see from the families?
Well, I think even before that, they might be given the diagnosis by their primary care giver, or their school nurse, or their gym teacher in the school screening program. And we know many of them have small curves, and so I often find it very rewarding to reassure patients and families that yes, your curve is small and probably not likely to progress. But I think you're asking more about moderate or severe scoliosis, where we have to actually institute treatment. Fortunately, that's not most of our patients. If you have a moderate curve, we can use a brace and hopefully keep the curve where it is and prevent the need for surgery. But if you have severe scoliosis, you might need surgery. Fortunately, we are working to make that operation safer, better, and more durable over time, so that many of our patients can experience return to full activities, a normal, healthy life, and have a durable operation that can last 60 to 70 years.
One of the things that's really been exciting for me today here at Nemours is to hear the mentoring that is happening, so that kids who've gone through surgery or kids who've gone through non-surgical treatment talk about their experience and share, so that they give hope to others who are just starting their journey or are in the midst of being treated. And that's such an important aspect, and we're so delighted to support this activity, because that hope is so important for families and for kids to know that they are going to get better and that things will get better. And so, Dr. Shah, you've been very involved in evidence development, in research. Can you tell us something that is on your mind that you are involved in now, that you're excited about from a research standpoint?
Well, one of the most exciting efforts we're involved in through the Setting Scoliosis Straight Foundation, arm in arm with the Scoliosis Research Society and investigators worldwide, is looking at the long-term follow-up for idiopathic scoliosis treatment. We know that left untreated, people can experience pain, decreased quality of life, and just basically stop enjoying the things they've always enjoyed doing. Does surgery get them to a point where they can continue their normal activities, lead a productive life, and be happy? The answer is yes, but we need longer-term data to prove that supposition. And it's going to take a lot of work, a lot of funding, and a lot of effort both on the surgeon community and the patient community to come together and generate some of this evidence so that we can show that the treatment for scoliosis is effective and long-lasting.
That is very exciting, and I love what you said in there, that it's a coming together, it's a collaboration nationally, internationally, to look at the outcomes over time. And that's something that is really exciting that's happening now, and we're just excited to be able to talk about that and share the science with the public. You can hear the sounds of kids and joyfulness all around us. It's a really exciting day here at Nemours, and really exciting for me to see the multidisciplinary team of folks that are here at Nemours. Dr. Shah, can you talk to us a little bit about the multidisciplinary approach to treating scoliosis?
Sure. I think it needs to be multidisciplinary, and it needs to be customized for a particular child or a family. So if you have a small curve, perhaps exercises might be effective. Definitely observation is certainly an effective form of treatment, just keeping an eye on the curve. If you have a moderate curve, bracing can be very effective, and we know this is evidence-based as well. And ultimately, if the curve is severe, we know that surgical treatment and various forms of surgical treatment, whether it's selective fusion, vertebral body tethering, a longer fusion, or revision surgery from growing friendly technology to a final fusion. There's so many different operations that can be customized for a child. The point is, I think it's a scary journey when you're on this side of the surgical part, especially. And it's intentional to have this event at this time of the year. Many of those people in the other room are going to have surgery over the next few months. And this is a preparation for them. It's an understanding for them to feel just a little bit more comfortable with what's in store. But then what's being shared is that kids that had surgery just months ago or years ago can tell them, hey, I'm on the other side of this and I'm thriving, and you can too.
One of the things we talk a lot about in the foundation is finding the right doctor for you. And I think that what I'm seeing here at Nemours is just awesome. These kinds of events happen around the country at various centers. We're thrilled that Dr. Shah has invited us to be here today to participate and partake in the activity, to share the resources that the National Spine Health Foundation has, the resources that we've made in collaboration with other organizations like the Setting Scoliosis Straight Foundation. And so our recommendation to people is to look for a center like Nemours, look for a surgeon like Dr. Shah, who's really reaching out and creating these opportunities for you to educate yourself so you can be your best advocate. Arm yourself with knowledge, get hope, and learn about the options, and feel very comfortable with the team that you're going to select to take care of you and your loved ones. Dr. Shah, do you have any closing comments?
I think it can be very difficult for people not involved in the medical field or lay people to understand all the information that can be thrown at them. I'm a big fan of the internet. I'm a big fan of empowering yourself with knowledge, but you have to know where to look. And that's what's so important about your group, Rita, and others like the Scoliosis Research Society and the Setting Scoliosis Straight Foundation. If you go to those sites, you're going to get information that's been vetted by medical professionals, evidence-based information, and things that are true, not biased, not harmful. I think those are the take-home points here, is that make sure you know the source of your information and be true to that.
That was brilliantly articulated. Finding information where people aren't trying to sell you anything, but trying to give you evidence-based, honest, truthful, vetted information. That is the key. Places like spinehealth.org, the Scoliosis Research Society, and the Setting Scoliosis Straight Foundation. I want to thank you, Dr. Shah, for sitting down with us during this busy, exciting day, and congratulate you on your incredible career and the incredible work you're doing here at Nemours for the community. And thank you again for allowing us to be part of it.
Oh, it's my pleasure, Rita. Thank you so much for being here and supporting this event.